Dental vet Dr. Christine Hawke loves her work, giving pets a new lease on life by removing their painful diseased teeth. But even she was shocked by what little Chica's X-rays revealed.
So what you've got here is, there used to be a big tooth here, so it's got two roots, and those roots are still in there. So here the bone should look like this through here, but you can see it's all gone, it's all infected and horrible. And we've got a little ulcer that we can see on the surface. It's probably draining from that. So what we're going to have to do is open this up, get the infected bone out, get these roots out, which is going to be fun. It's much easier if you've still got a crown on it. So.
It's a timely reminder for pet owners to ask their own vet if they routinely use a digital X-ray. Most practices have them now, but just 10 years ago, Dr. Christine was one of only a handful of vets in the country with digital X-ray equipment.
There we go. That's the big root from the front. I'll take it out of the light.
Now, some people put off getting their pets' teeth cleaned because of the myth that older pets won't survive being anaesthetised, a fear Mythbuster Dr. Christine happily describes as completely out of date.
It can be a bit nerve-wracking, mainly for people, but we do our anaesthetics the same way that humans do. We can take so many precautions, know exactly what their organs are doing, change the drugs around, use fluids, use all the things we need to get them through that. There's always going to be a risk, particularly if they have other diseases, but the age is not actually the disease. So I would rather anaesthetise a relatively healthy 20-year-old than anaesthetise a very sick 2-year-old.
The key to better anaesthesia? A pre-operation blood test to detect any organ damage, which would then be managed by adjusting the medications used. In Chica's case, no problems with this 12-year-old. Her blood test was all clear, and she slept peacefully while Dr. Christine removed 7 rotten teeth. Vet nurses Maria and Liz constantly monitored Chica's vital signs, ensuring she was warm and well hydrated to help flush the anaesthetic out of her system once the operation was over. Nurse Maria providing a bonus, trimming Chica's nails and expressing her anal glands.
You okay? Hello, gorgeous girl. Just don't bite your tongue.
With Chica spending the next few hours being monitored in the recovery ward, Dr. Christine reassured her nervous parents, that would be me and the cameraman, about Chica's future well-being.
She will be fine because we will use lots of pain relief. I just assume that it's going to hurt, and I give her what I wanted my dentist to give me when I had my wisdom teeth out. So she has had an opioid before she starts, so she's had methadone, which is like a version of morphine. She has had local nerve blocks, so that when we've done any drilling or anything painful, the nerve sensations never actually made it through to her brain, which gives her less pain afterwards. And she'll be given lots of drugs afterwards to go home on.
Maria, clearly you all love animals.
We do, we very much so. And look, it's best for the animal. A lot of people don't think that dental work on an animal is important. It's just as important as desexing. It's just as important as if they come in for surgery for an ailment. But dentistry is really important as well. They can having bad teeth can cause a lot of problems, and people need to know that just as they go for regular checkups every 6 months or every year, so should their pet as well. And you'll be surprised what you can find out just from an animal's mouth.
And they were right. Chica came home showing no signs of being in pain and started eating the next day the roast chicken that Christine suggested. And over the next few days, this little 12-year-old suddenly started acting friskier, something Dr. Christine says she hears all the time.
So many animals, I mean, some of it can be because of the pain, but even when we do a really good deep clean, we might not take out any majorly painful teeth. The number of people come in and say, he's 10 years younger, and you know, that's kind of a big thing when you're 15 years old.
So thank you again, Dr. Christine. Chica will see you for her checkup in 6 months' time.